Doctor, are you living the dream or just dreaming of living? It is my honor to announce the PDA 20th Anniversary Special Conference this September 12th to the 14th in Frisco, Texas, the nation's leading course on dental practice growth. If you feel isolated as a leader who is frustrated that your schedule is unproductive, maybe your team is disjointed, or your systems are inefficient, this is the conference for you. The PDA 20th Anniversary Conference has all new features, including keynote speaker Emmitt Smith, who is a Pro Football Hall of Fame running back and entrepreneur. You can choose your own educational track to customize your learning experience. And when you register before July 1st, you will receive a 90-minute pre-meeting session that can help you boost and increase your productivity before you even attend the conference. Go to www.productivedentist.com and click the pop-up, or select Productive Dentist Academy Conference under the Dental CE and Events tab. That's www.productivedentist.com. Seating is limited. Register today, and we look forward to helping you make your dreams become reality.
Are we comprehensively diagnosing? Are patients saying yes to their own good health? And that is really where it all starts and stops.
Welcome to Investment Grade Practices Podcast, where we believe private practice dentists deserve to get the lifestyle today while building an asset for tomorrow. Join your host, Victoria Peterson, to design the practice of your dreams and secure your financial independence. Let's get started.
Welcome to another episode of Investment Grade Practices. I'm wondering, what is the most important metric in your practice? I ask this question all the time. I ask it to CPAs, I ask it to private equity individuals, I ask it to people in solo practices and DSOs and brokers and dentists. And it's amazing how the answer is wildly different depending on who I ask. And so I'm really starting to think, if I'm building an investment grade practice, what's the number one number? And most people are going to say EBITDA, right? My earnings before interest, taxes, depreciation, amortization. If it's not expressed that way, it's expressed as net profit. And if it's not expressed that way, it's profits minus seller discretionary earnings. I usually get a very logical financial accounting term. And I think to myself, is that the most important? Is that the one that measures the future success of this business or not? And for me, EBITDA is a lag number. It is what happens once the train is stopped. It's in the station. It can be measured afterwards. It's a rear view mirror number. So is that really the most important number? Or are there other factors that have to happen in order to get there? We call those lead measures or lead metrics. And for me, the number one lead metric is, does patients say yes? So are we comprehensively diagnosing? Are patients saying yes to their own good health? And that is really where it all starts and stops. And it gets so confusing because we let that number get muddled, right? Insurance won't pay for this, or you don't understand, in my area, patients won't accept this or that. So let's just start with the premise of your philosophy of care, because that's what drives patient care. And patients saying yes to their own health depends on how you view their health. And the view of your business expands as you expand your mindset of what's possible for your patients. It's all one and the same. We're in the service business. We're in the health business. So how do we get the courage to share all that we see with the patients without blowing them out of the water? Because for me, that, as a business owner in dentistry, nothing is more important than the patients honestly knowing what is happening in their own mouth. It's difficult for us as providers to look in this dark space the size of a tennis ball and accurately diagnose what's going on. Patients have no chance. It's an invisible disease, much like heart disease, which we have blood pressure and pulse and a few other, metrics to predict if you're going to have a heart attack or not. But In dentistry, we've got tools, we've got insights, and we can help. But maybe it comes down first in removing the fear of having the conversation. So perhaps patient care and what they say yes to isn't the most important metric. Maybe it comes back to, on a scale of 1 to 10, how comfortable am I as a clinician in sharing all that I see? And I'll tell you, I have doctors give me wildly different answers on why they don't share everything comprehensively. First is, I'm going to blow the patients out of the water, that I'll get bad Google reviews, things like that. If you go deeper, I actually have doctors say, well, if I did everything that's in their mouth today, then I would have to go get more new patients because there would be no work for me to do tomorrow. So there's a prevailing wait and watch and hygiene annuity, and I'll get it next time. But what if we could change our communication skills and your philosophy of care? It's just an invitation. No one listening to this podcast has ever said, man, I'm adopting your philosophy of life. So take from this what you will. But there is an invitation that says, what is my philosophy of care? If this were my own mouth, if this were my family, what would I want for them? Get rid of all the money, get rid of all the other things. What would I have done in my own mouth? And then find the courage to present that to your patient. So if your philosophy of care is we remove obstacles to care so that patients can get comprehensive care, fantastic. If it's we're an emergency clinic and we really focus on serving that segment of the community where people come in pain, we relieve their pain and they come back the next time they're in pain. Define it so you know that's what you are. If your practice is we don't work in pain or comprehensive care, we only do aesthetics, fantastic, define it. There's a room in every marketplace for all of those scenarios. There's room to work with those who are the most fragile and lower on the economic scale and make that a profitable model. So don't be confused about your model. Figure out who you are, who you serve, and then develop your philosophy of care from there. If you are going into a more comprehensive, particularly if you're looking, and I see that recent survey says 60% of dentists are now either actively downsizing their participation in insurance or considering going out of network completely. If you're on that path, then I invite you to put this one question into your exam process. And it goes something like this. Victoria, as I go through and I do your exam, I'm wondering, would you like for me to share with you everything I see so that you could prevent further decay down the line and further problems down the line? Or would you rather wait until something's critical and I tell you about it at the time it needs to be repaired? It's just that simple. Find out, are your patients preventive mindset? Are they curious about everything that you see in their mouth? Or are they like, hey, doc, nope, just tell me what you got to fix today? And I know that sounds crazy, like maybe everybody would want to know, but I have a cousin, Billy. If you guys know me, even for a nanosecond, you know I was raised in the South in the Okefenokee Swamp down in St. Mary's, Georgia. It's coastal, it's beautiful. All the barrier islands are there. It's a really beautiful place. But we did not grow up with a lot of money. And I saw my cousin Billy at a family reunion about 6 years ago, and he literally had no teeth. And coming from dentistry, seeing your cousin with no teeth, I was aghast. And I was like, Billy, what happened? And he said, oh, you mean my teeth? And I said, yeah. I said, where are they? He said, well, I went to the doc. I'm going to get Southern here. He says, I went to the doc and he said, well, you got 12 teeth that need fixing and it's going to be about $12,000. And I said, dang, doc, I ain't worth $12,000. I've never had $12,000. So just pull them. And I said, all right, Billy, well, I get that. But didn't he give you dentures? Didn't he give you a replacement for your teeth? And he goes, oh, yeah, he did. But my daughter said they look like horsey teeth. So I put them in a drawer and I've just learned how to eat and I'm fine. I can eat corn on the cob, I can eat steak, I can eat anything I can. So patients come in all different flavors. He went through with the treatment. He said yes to treatment, but he said yes to treatment on his own terms. And hooray for the dentist who said, to restore your mouth, it could be this way. So is it EBITDA? Is it net profit? Is it patient satisfaction? Is it patient saying yes? There's so many things that we can measure. But to build an investment grade practice, one that has predictable, durable systems, my encouragement is that you really sit down and take the time to craft your philosophy of care. What do you believe is in the best interest of the patients that you serve? And then articulate that through your standard of care with the team. When I see a hole in the tooth that looks like this, I'm most likely to recommend that. When I see bone loss, I'm going to get curious about this. We generally do that. Develop this tooth by tooth, quadrant by quadrant, full mouth by full mouth. How do you view diagnostics? And how do your hygienists view diagnostics? Get coordinated on that. Make sure that your assistants and your admin can convey the reasons behind your treatment planning. Doctors who do this have doubled their case acceptance within 30 days, just getting clear on what it is. If you combine that with great patient financing so that they can say yes, you'll triple your impact. So I'm a great marketer. I love new patient flow. That's a metric I look at a lot. But if you really want to grow your practice and make it predictable, get clear on your philosophy of care, how you want patients to be treated, and offer them an avenue for saying yes.
Thank you for tuning in to this episode of Investment Grade Practices Podcast. If you find value in this episode, help us spread the word by passing it along to a dental friend, subscribe, and give us a like on iTunes or Spotify. Learn more about building your investment grade practice at productivedentist.com today.